Hi, my name is Brittany Dupree, and I'm a physical therapist here at Gonzalez Healthcare Systems. According to the CDC, a TBI, or traumatic brain injury, is caused by a bump, blow, or jolt to the head that disrupts the normal function of the brain. The seriousness of a TBI can range from a simple concussion all the way to a severe TBI. Intentional falls, being struck by an object, or being involved in a motor vehicle accident are the top 3 mechanisms of injury of a TBI. Traumatic brain injuries are most prevalent in adults over the age of 75, children 0 to 4 years of age, and children 15 to 24 years of age. March is Traumatic Brain Injury Month, and here at Gonzalez Healthcare Systems, we would like to touch base on how the physical therapy team, the speech therapy team, and the occupational therapy team can be involved in a patient's care after they've sustained a traumatic brain injury. Physical therapy, occupational therapy, and speech therapy are an integral part of a traumatic brain injury patient's return to their prior level of function at work, home, and with other activities. In physical therapy, we address the patient's core strength, arms and leg strength so they can return to activities that they love. We also adjust their balance or lack thereof and their ability to walk with or without an assistive device such as a walker or a cane. Physical therapist's goal is to help the patient be as independent as possible and as safe as possible with every aspect of their life, whether it is in their home, community, or at their workplace. Occupational therapy assists TBI patients with returning to activities of daily life, like brushing your teeth, showering, and getting dressed. They can also help patients address independence with specific activities so patients can return to work. Occupational therapists can teach patients new ways to achieve old tasks with more independence and confidence. OT can also teach TBI patients coping skills to overcome emotional and behavioral difficulties, which are symptoms of a traumatic brain injury. Occupational therapists also work with speech therapists to progress social skills, cognitive skills, and memory skills to return to independent living. Speech therapy is also an important asset to a traumatic brain injury patient's rehabilitation process. Speech therapists assist patients with speech and language deficits such as word finding or slurred speech. Speech therapists assess and manage communication disorders to include problems expressing ideas, thinking of words, and forming sentences. Speech therapists also design and assist patients with communication aids such as picture boards and computer-based systems. Lastly, speech therapists can assist traumatic brain injury patients with swallowing and eating difficulties. Here at Gonzalez Healthcare Systems, we take a team approach to addressing each patient's functional limitations after sustaining a traumatic brain injury. We work together to develop an elaborate plan of care just for you. Here at Gonzalez Healthcare Systems, we want you to feel the difference in your healthcare.